Hello guys, so we are back with the second part of the video. In the first part, I covered the basics of how to start preparing for MCI. As said before, I'll be covering the division of the subject, marks, and the books you can follow during MCI. Okay, before I proceed, it is a disclaimer. These are the things which have helped me in clearing my MCI examinations. You may have different views, other people may also have different views. So kindly don't go into an argument because it is just my views, and I am just trying to help you as much as possible. So let's start. I have written down and researched a little bit more. Maybe the loopholes which I had, I'll try to cover them so that it's helpful for you people. So first of all, I'll go about with the marks division. First, it's pre and paraclinical subjects, anatomy. It's 17 marks. See, it's more or less, it's approximate. It's never just 17, it may be 15 or a little bit more. But on average, anatomy has a value of 17 marks in the examination. And to prepare anatomy, you can follow the notes for the theoretical part and also for the extra information which is not available in the notes. Try to read it from the book called Across. Across is really a very good book for anatomy. The level is little up, and that's good because you will be covering everything and there will be no loopholes for anatomy. And there is one more book I like in anatomy which I personally solved, that is Fabian. But the book according to a few people is kind of tough, but the theoretical part is good, and upper limbs and lower limbs are quite short and to the point in that book. So to your own, which book you like, just go through a bit while you're buying it, and whatever is attractive to you can get that, because both are same, but Across is much more popular around the market. Most of the people follows it. Biochemistry, first of all, my subject biochemistry was actually a big one of my strongest subjects, and that's just because of Dr. Dharmendra's notes. It is like one of the best notes I have ever read, and I didn't go for any other book. Yeah, definitely MCQs I solved. It was from FMGE Solutions or Kamal KV. Again, the thing, you can solve both the books or choose any one of them which you like. Again, most of the people right now prefers FMGE Solution, whereas I personally solved Kamal KV. That's how it goes about. And then is physiology, and physiology, again, I didn't follow the books because it's quite vast. So in DIMS, the points which is most commonly asked were covered, and physiology, so I did it from the notes. Okay, I forgot one point, that is biochemistry also holds the value of 17 marks and physiology also holds the value of 17 marks. Okay, then microbiology, the marks value is 13, and the notes in microbiology, again, it's very vast, so it's very much needed that someone cuts shorts it for you, and the points which is often asked in the examinations are followed. So that is, I followed the notes of Dr. Akhilesh. So it's also very good notes, and very many mnemonics are made, and it's quite easy to grasp if you go through continuous revision, because microbiology there is nothing to understand. It is basically mugging up. So जितना आप उसको बार बार revise करोगे उतना grasp होगा, and it will be easier to remember. So yeah, that's done. Then pharmacology is also 13 mark subject, and obviously the notes is none other than Dr. Govind Rai Garg, and also the MCQs you can follow from his book if you have time, but it is time taking. So again, if you don't have time, you can again go for the MCQs in FMG Solutions only, but the notes is more than enough. So the theory and everything will be from that. You can just solve the MCQs from wherever you want. So that's the thing. Okay, FSM, forensic medicine. Forensic medicine is also Dr. Akhilesh's notes, and I love that notes because forensic, he taught in a way that it was like in both sides of the palms. Like I could just tell a forensic medicine before the examination, it was in my fingertips because the mnemonics was so great. But for this forensic medicine, to understand his notes, you need to attend his classes, because he teaches in a way which will just registered in your mind, and without attending the classes, following the notes is a little bit difficult. That's what I feel. And also the review from many students and my fellow mates also, it's that they found it hard to read from the book, but it was easier for me because I attended his classes. And forensic medicine also, the notes you can do from FMG solution, and anywhere you get the MCQs. See, MCQs is something which will increase your critical thinking, so follow one mother book for MCQ which you will select on your own, which has all the subjects, so that you can revise that another time. But wherever you get whatever MCQs in whichever source, try to solve it as much as you can. So as I said, pharmacology is also 13 marks, and forensic medicine is also has a value of 10 marks in the examination. So here, after discussing all these subjects, we come to an end of pre and paraclinical subjects. Now I'll move on to clinical subjects. So the major clinical subjects are medicine, surgery, PSM, and gynae obs. So medicine has a value of 33 marks, surgery has a value of 32 marks, PSM has a value of 30 marks, and gynae obs has a value of 30 marks as well. So medicine, it's none other than Dr. Marwa. So either you follow his notes or either you follow his books. It's the same thing. I followed his book. And surgery, Dr. Pritesh Singh, and his book is enough. And then we have PSM. It is none other than Dr. Vivek Jain. Solve his you can read his notes. That's what he says in class also. You can read his notes and also solve all the MCQs in the book. Read the notes and solve the MCQs. No need to go through the theory. Or else, if you want to skip the notes, take that green book which is for FMG solution. Now maybe the cover change or not, but during my time it was green. So that dark green book, you can read it whole. So that's what you all need to do in PSM, and thoroughly prepared. And gynae obs, my teacher was Dr. Harmeet Goel, and I followed her notes and also her book, that small blue book. It has the highlights as well as the MCQs. I found it very helpful, whereas few people also says that the material is short, and Sakshi Arora ma'am, like Dr. Sakshi Arora's notes are much better. See, I won't comment about it is better or which is better, because they are excellent in their own field. So for me, my teacher was Dr. Harmeet Goel. I loved her notes and that helped me a lot. And gynae obs, I didn't find anything difficult to solve. Yeah, the book which she has written, that has a particular type of MCQs which is directly from the notes, and in our examination, the kind of question which comes, it is mingled. Like gynae is also sometimes paired with medicine. So as I said, for improving your critical thinking, solve as many MCQs as you can, because in gynae obs itself, I can give an example. If you go to solve from Kamal KV, Dr. Kamal KV's book, if you go to solve it, you will find a lot of doubts coming up. But again, you dig into the theory, you will see that it's there, but you couldn't just relate. So that's what I'm trying to point, that solve as many MCQs, and where you have the doubt, just go and dig into it and read it once again. You will definitely get the thing कि इस तरीके से सोचना है एग्जाम में, बिकॉज एग्जाम में बहुत ज़्यादा सोचने का टाइम नहीं मिलता है हमें. That's it. So these are the 4 major subjects I already said, and इसके बाद आता है one of the major subjects, pediatrics. See, pediatrics is a subject which I found little tough, but then one hack is like always related with medicine, and pediatrics का notes, Dr. Marwa's notes is again the best, and solve it from FMG solution or Dr. Kamal KV. The questions, pediatrics holds a value of 15 marks. So yeah, that is it. And then I'm coming to the scoring subjects, that is ophthalmology. For me, he's also one of the best teachers I came across so far. It's Dr. Utsav Bansal, and he's really an amazing teacher. And ophthalmology was like it was a super game for us, because he was our teacher, and by the end of his classes with proper revision and everything, ophthalmology was very much in my it was one of my strongest subject. I grasped it really nice. So it is that, and also the questions, he continuously posts questions in Facebook. Also he has a page there, you can solve the questions, and also again same, no need to repeat it, you can solve from any other book. And right now Dr. Utsav Bansal has a book which is Soch, that also has questions, but during my time it was not released. That time Dr. Ruchi Rai, yeah, ma'am's book was in trend. You can solve the questions from there, or you can also follow wholly that thing. But for me, he was my teacher and I'm very satisfied with it, no complaints. And then coming to the thing, ENT for UG level, not much good books are available, so you can just follow, you know, the questions and also the notes, DIMS, the notes, that notes you can follow, that is really good. And peds also, peds I already covered. So radiology is divided into radio diagnosis and radiotherapy, which is 5 each, so consisting of 10 marks. Radiology you can do from profs, and also the notes given in DIMS, that is enough. And radiology you need to also focus on the fact that the pictures will be coming, slides, so kindly prepare it, and in all over internet many slides you will be getting, so focus on that. So these are one of the scoring subjects I finished, and then comes the super short subjects, which is of 5 marks each, and it is dermatology, psychiatry, ortho and anesthesia. So dermatology is also Dr. Akhilesh ka notes, and then psychiatry Dr. Dharmendra's notes, and anesthesia Dr. Govind Rai Garg. With pharmacology at the end he gives us a very short notes, and so far I have found that is enough for studying in anesthesia. But if you want to study more, then you can do something is like you can do anesthesia from profs itself, it's good. And ortho Dr. Apurv Mehra, his notes is enough, the questions and everything which he has given is enough. So here I conclude the preparation and the marks division. So again repeating, dermatology, psychiatry, ortho and anesthesia has a value of 5 marks each in MCI. That's it. Now I will be telling you the days you need to prepare each subjects. Okay, so this is it can vary from person to person, but I will be giving you an idea. So it is like basic subjects, anatomy, I'm giving it a span of 4 days because it's really vast. 4 to 5 days you need, but don't waste more than this time. This is the first time I'm telling. Second time also you can devote this much of time. Well, if I consider a span of 5 months, your study, reading the notes for the first time should be ending by early 3 months or 2.5 months, and then the rest of the time you have to revise at least 2 times and also attend the mock tests and all these. So you have to finish the subjects by 3 months. So see, anatomy is 4 days, biochemistry 3 days, physiology 3 days, microbiology 3 days, pharmacology 4 days, and forensic medicine is 2 days. So this comes to like around 20 days, and that can you can take it as 30 days also. 20 days is the exact number, but obviously it will not be matching to like everyone. This was my estimate. I also more or less took 20-25 days, so let's consider 30 days. And then coming to medicine you give 5 days definitely or little more. Then surgery is 5 days, PSM 5 days, gynecology 5 days, major subjects, vast subjects 5 days each. So medicine, surgery, PSM, gyne-obs itself 4 subjects together, it's consisting of 20 days, it's taking up 20 days. Then ophtha 3 days, ENT 3 days, peds also maybe 2 days or 3 days, radiology 2 days, and the super short subjects derma, psychiatry, ortho and anesthesia 1 day each. Okay, so here what I'm trying to say about the days. Now many people will have a question, ma'am, if I'm studying from the book it will need more time. I know this argument is gonna come, so please again remember the disclaimer which I said previously, and also the sources through which I studied. Now please give it a thought that I have studied mostly from the notes and books I took as a reference, because what I feel, there is no point lying or not being honest. If you prepare from books, you need at least 1 year time. Through books you cannot ever complete the whole syllabus in 6 months, and I am considering that you are completing everything in 6 months, so the time limit is 6 months. Based on that, I have made this video. So that's all. That is the end which we have reached, and in the third part I will be talking about how to break the subjects and make a routine, combination studies, and also how much time you will be giving, and the pros and cons of studying in the day and as well as night. So yeah, that's all. Thanks a lot. And if you have any queries regarding this video or any other details you want, kindly comment below.